Hi, everyone. Welcome back to another episode of Forward Physio. I was very fortunate to speak with Heather Linden, who is the director of rehab for the UFC. There were two main goals of this episode. The first was obviously to provide insight into Heather's job with the UFC, how that works, and how cool it is, but also to take important lessons that she has learned throughout her career so that we can be better physical therapists ourselves. If you don't know who I am, my name is Noah Mandel. I'm a Canadian physiotherapist, and I interview experts from around the world in the spaces of physical therapy, medicine, and rehab so that we can become better healthcare professionals with the knowledge that they share with us. If you enjoyed the podcast, I would really appreciate if you would leave a review. It helps the podcast grow so that we can reach more and more people. Now, enough of me. Without further ado, I bring to you Heather Linden. Heather, could you ever have predicted that you would end up as the director of PT for the UFC?
Absolutely not. Not in my wildest dreams would I have thought that I got into combat sports. That was so far from what I really thought. But you know what's funny is I grew up in New Jersey, and all of my friends, brothers wrestled. I actually cheerleaded for wrestling instead of basketball in my hometown because our wrestling team was so good. We were always like state champions and things like that. So funny that back in the day, I was actually a cheerleader for wrestling rather than your typical basketball growing up. And then who knew I would then evolve into combat sports? Maybe that was a sign a long time ago that I never even realized.
Huh. So I know that you started off in sport as well. How did you get into the combat side of things?
Yeah, so I mean, I've always absolutely loved sports, and I would say most physical therapists want to go into sports, want those sports jobs. And I always thought I would have that typical progress where, either football, soccer, some of those other really, more normal sports, right? That you would think.
Yeah.
And I think when I stepped into my first day at the Olympic Training Center and I was tasked with covering wrestling practice, that opened the door to something that I think just really hit home in the sense of like it's not your very structured, it doesn't follow one pathway. And I
Hmm.
think that's kind of how my life has always been is, I wasn't the smartest person in the class, but I was the person that was going to apply myself. I was the person that, didn't come easy or natural. So I always had to, push myself to get to somewhere. And I
Yeah.
think that's something that I really, my first day at covering wrestling practice, I really loved that about the combat sport, right? Like they defy what we are taught. They defy what an athlete can be. And they really don't give up. And I think that's something that really hit home with me. And that's probably something that maybe interests me into this combat venture that I've kind
Hmm.
of been on.
Hmm. Do you feel like you sort of relate to the athletes in a way where they never give up and like you see yourself in that a little
Yeah,
bit?
I would say I definitely see myself in that way. I would say, as a female PT 20 years ago, when I first graduated, sports was not something that was common. And I was like, that is what I want to do. So I just never really gave up. And I think
Hmm.
that's why in this population, when we're doing all of our decision making, I really have, I would say, a lot of empathy and a lot of just compassion for this population because I'm like, wow, it doesn't always fit your standard box, right? Or anything like that. So I think that's something that definitely rings home with my entire journey.
Right. It's not like a cookie cutter approach. And I imagine you're dealing with maybe more complexity and uncertainty than most physios would ever need to. Like you see a fighter maybe during their training camp or after a fight and they are just riddled head to toe with injuries, right? And there's probably so much, at least maybe earlier on in your career, that you were so unsure about. So, what would you tell a younger Heather
Mhm.
to help her sort of deal with that complexity and uncertainty?
Yeah, and I would say, start with the basics when it comes to things. And I think this is how really the evolution of physical therapy has become is you get out of school and you know your basic and your fundamentals, but then keep that open mind and drop your ego at the door and kind of learn not only from other clinicians, but also the athlete in front of you. Like a
Hmm.
lot of the times that patient that is sitting in front of you is telling you a story. And I think, unfortunately, we're so used to answering or having an answer that we don't always sit back and listen to the story in front of us. So I think I would have told my younger self that it's okay not to know everything. Sit back, listen, and just start chipping away. And I think that's something that a lot of people can relate to professionally, also when they're handling more complicated cases.
Yeah. I think you're in such a fascinating position working in this really, really like high pressure scenario. And I feel like there's so many lessons that a lot of physical therapists can draw from you, even if they're not dealing with, UFC fighters.
For sure, for sure. I mean, every day we have to be adaptable, right? Every day we have to flex. There's not these benchmarks that this athlete population always hits that makes it easy to make return to play decision making, to make decisions on what they can and can't do. So I think with that complexity of the sport and this athlete, it allows us to continue to evolve and continue to, challenge the systems that maybe we were taught in school or that we were taught in your normal physical therapy clinic, right?
Hmm.
I mean, one of the things I always say or talk about is, we see our rehabilitations 5 days a week, twice a day. And we really front load those rehabilitations. And we don't see that in the general population, right? Because insurance or other decisions are made from physicians that say like 2 to 3 times. But then I was always that person that was like challenging why 2 to 3 times? Like, who made this decision? Like, look at the person in front of
Hmm.
you and then make that decision a little bit better. So when I came over here at the UFC, they were, build your pretty much dream. And I was like, I think we need to look at the person in front of us and make our decisions based upon that, not just what a textbook says or what the, typical rehabilitation looks like.
What else fits into that dream of building your own, ideal performance institute?
Yeah, I think first and foremost is the athlete centered approach on that. I think, like I just mentioned, the athlete tells a story, and I think we have to be adaptable to what their needs are and to really be empathetic and understanding when they come in front of us. So I think my dreams are always to have a really athlete centered model that really meshed all different sports medicine clinicians. I wanted, I've learned a lot of my really, I think, successful techniques from chiropractors, from athletic trainers, from
Hmm.
physicians, from osteopaths. So, having that open mind and really bridging that healthcare, because we all want the best thing for that athlete or that patient in front of us. So, why we've developed so many silos or we've developed so many barriers to not make each other better. I
Hmm.
mean, when we look at the amount of people that are in this world, right? Like there's no way as physical therapists, or any sports medicine clinicians that we could even see the amount of people that are in this world, right?
Yeah.
I mean, the population just is ever expanding. And I think that's one thing we're so worried about having those patients and, making that money, but we forget that there's plenty of people to see and help. And I always say that when it comes to athletes, like people are like, you let people come in and shadow, or you're very open minded to talk shop with other clinicians. And I mean, I think that's how we learn and that's how we get better is, taking all this great insight from other professions as well. And then, meshing that with what we've learned. And then we just become a world of knowledge.
Yeah. So many young physios I find really, really, really struggle with saying, I don't know, or I'm not sure.
I mean, I
So,
don't know. I've been doing this for 20 years and there's going to be, I'm probably every day there's something I'm like, I mean, we literally just had a case downstairs where this athlete is getting severe pain at night. So my team is thinking stress fractures, bony, and then goes in, trains in the morning and looks great. And I'm like, well, if their lower extremity had a stress fracture, there's no way they can be jumping, kicking, and not having that all removed just by adrenaline. You know what I
hmm.
mean?
Yeah,
So I
yeah.
think every day the team is constantly having to, look at those cases with a different kind of microscope and a little bit different than the normal. And I think that's what makes this population so special to work with.
Yeah. I think the concern with a lot of people is that they may feel like the athlete or their patient then won't trust them or think that they're an expert. I have two questions about that. But firstly, when you tell an athlete that you're not sure, do you ever feel like you're losing trust in them, or that they're questioning
I,
your
I
expertise?
think you gain trust actually, because I
Yeah.
mean, I think when an athlete, when you look at them and you're like, okay, I had an athlete yesterday that was like, I think I ruined one of my, surgeries. And I was like, I really don't think we did. Like, let's let this play out. Give me a few days. And immediately that athlete goes down that rabbit hole. Like, I'm talking, reached out to every single one of my clinicians. Don't you think I need an MRI? Don't you think? And I'm like, unless there was an incident that occurred that you're not telling me about, nothing you were doing sounds like you would have ruined your surgical repair. So I said, like, trust the process. And I think when you start opening up and saying, like, okay, give it a few days because I'm not sure, let's see what this amounts to. I
Yeah.
mean, so many times I just had this conversation with my team in China, like, hey, coaches want that immediate diagnosis, right? And sometimes you see an incident happen and you're like, oh, this is going to be bad. And 48 hours later, they look great, right? And vice versa. Sometimes you get a patient for the first time, you're doing an evaluation, and you're like, this doesn't look too bad. They're very functional. And then you find out their ACL is gone, right? It's one of those things where I think, like, being able to admit, like, medicine is not perfect. We know
Yeah.
images, diagnoses that have been missed in all sorts of medicine. So I think the more information you can gather and bank a really good story there, the better your results are going to be. So by saying, hey, give me a few days, let's see what this looks like. We'll keep going objectively. We're doing no harm to what are any of those diagnoses are. We treat this all the same. We're going to do pain modulation, edema control, all those basic things that they did teach us actually in school, which, we always say they didn't teach us enough. But if we stick to those fundamentals and understand that we might not have the answer immediately, I think you actually gain more trust from the person in front of you.
Right. So you're explicitly saying, like, give me some time, but at the same time, you're saying, here are all the things that we're going to
Exactly.
do.
Yeah.
Here's what we can do if this happens. So you still have a plan. It's not like you're just throwing your hands up in the air and saying, I have no idea what's going on, and I'm not going to help you.
Exactly.
Right.
Exactly.
So I can imagine that really helps build some trust. And you mentioned also listening as well. And I know that you sort of had this journey when you were first starting at the Performance Institute of building trust in the athletes and sort of overcoming the challenge of them not wanting to go to you. Could you tell us a little bit about that?
Yeah, I mean, I think the first day I arrived, there was the big red X across the door saying, whatever you do, don't go into the office of Heather because she might find something wrong. And I mean, I think we had to, drop down those barriers by initially even just doing like massage work, right? Because the athlete wasn't feeling great, needed a little work done, but they wouldn't quite trust us enough. So when
Hmm.
you start getting your hands on them and you're talking about the knowledge they start understanding and saying, actually, can you check my shoulder out too? Because that wasn't feeling 100%. So, it's that give and take to build that trust. And that is something that's so important. And I think we all struggle with is gaining that trust with our patients in front of us. And if you can get buy-in from them, your outcomes are going to be so much better.
Yeah.
And they will then admit when something happens and maybe when something doesn't go as planned. But if you don't have that foundation of trust that you built, and I think for us, we just had to keep at it and making sure we were there for athletes no matter what. I also was very vocal about, I'm not here to pull you from an event. I'm here to come up with solutions to get you to that event safely. And obviously, if there's something from a huge health risk factor, I'm going to step in and have, a very loud voice in that. But I'm going
Mm-hmm.
to bring it into a team environment, right? We're going to talk to the coaches, the athlete, the managers, and all of us can come up with a solution that fits that athlete in the time of need. And I think when you start doing that and having that open door to discuss and give and take what you can, I think that really starts to build that trust as well.
Right. So what are those instances where you want to do everything you can to get the fighter in the cage or in the octagon rather, but you still you like something's just not right and you really want to hold them back? What are those instances?
Yeah, I mean, I think I had a really good example of it. We had an athlete, gosh, probably a year ago, that injured their ankle upstairs training. The team ran up and someone was like, oh, I think they dislocated their ankle. We were like, uh-oh, this is going to be bad.
Yeah.
We ran up the stairs to where the training area is, and that athlete was up walking. And she was like, I'm fine, I'm fine. So, okay. So we go downstairs, we do our list of Ottawa ankle and foot rules. We clear everything. The only thing she has is some point tenderness on the fib head, and that was it. The athlete could walk, the athlete could jump, do a single leg hop. Everything else this athlete looked great in. Obviously, the next day came and there was some swelling. So we were like, yeah, you possibly sprained your ankle, did this or that. And this athlete was like, well, I'm fighting anyway. I'm fighting in 6 weeks. I'm not worried about this. Let's just treat it as an ankle sprain. I don't want further diagnostics on it, this, that, and the other. So my team went about 7 days and they were like, hey, she's doing great. She has no complaints. She's starting to train again, but something just doesn't feel right. So they're like, if you have a second, can you come down and just check her ankle?
Yeah.
And I immediately was palpating and I could just feel like a divot in that fib head. And I was like, you guys are right. There's something off on this. Now, here I was trying to convince the athlete to get some imaging. And the athlete was like, I don't want any. I'm going to train anyway. So I pulled the athlete, I pulled the coach, and we went into a private room and I said this. If you have torn every ligament in this ankle, I really don't care. I'm honest. You look so great functionally. I don't care if you have a torn ligament or two. Don't. But I said, if you have a fracture and somebody kicks you in that fracture, you can quickly have an open fracture. And we've seen what happens with that. And we see that rehab then goes from being really simple to really complicated. And now you're missing a year of your career. So let's just talk about the risk. Let's talk about the reward. Let's talk about your game plan. And the coach is like, actually, her opponent does a lot of kicking. And I'm like, okay. So this is going to be bad. If you walk into that octagon and there's one kick and this is positive for a fracture, there's no way you can use the tools and the resources that you have to give yourself the best option in that octagon. So I said, let's just go get an x-ray. If the x-ray is negative, then I don't care. We will worry about the ligaments and stuff afterwards because you look functional. But if what my intuition and what my team's intuition is telling me that there's just something off, and she had a huge fracture across her fib head.
Whoa.
And she was like, we have to remember, right? The fibula only weight bears, 13% of or 16% of our body weight. So yeah, you can present super functional. But if she had gone into that octagon and they had a kick, that could have been detrimental to her career and the longevity. So those are those important conversations. Those important conversations where you pull them in and you talk to them as humans and people. And here's the risk. Here's the rewards. Give me a little and I'll take an inch. I don't care about that ligament, but I do care about this bone. This is where it's going to be a lot more of a risk for you if that were to be injured further. And I think when you start really talking to them like a human and you have those really good conversations, great solutions come out of it.
Right.
And she ended up just needing a boot because it wasn't displaced. And, 6 to 8 weeks later, she's back and ready to fight again. That is a way better, healthier solution than risking that.
100%. I could also imagine in the fighter's perspective that they really appreciate when you're sort of bringing in the actual fight itself.
Yep.
And talking about if you get injured, here's what you can or cannot do in the cage. Or if you get a leg kick, you're actually relating to their sport instead of saying, hey, this is a bad injury. You shouldn't do anything. Right. I imagine that message wouldn't be received very well, especially for these people that are just so tough and want to do anything to fight.
For sure. And I think in any aspect, as a patient sitting in front of you, as an athlete sitting in front of you, if you can relate to what they're doing and the requirements of their sport, you're going to get way more buy-in.
Yeah, for sure. So the times where you are a little bit more concerned, maybe not a ligament tear, but there's fractures, right? Does that include stress fractures or higher risk stress fractures? Are there times when you're saying, you know what, the risk isn't too bad here, but if this so walk us through stress fractures and how you approach that.
Yeah, I mean, I think for stress fractures, obviously, there's still that risk that we're going to see. The one thing that we have to keep in mind, though, with this population is, this sole income of what they might make in that fight supports their possible entire family. And
Hmm.
who knows for how long, right? They're not like any other sport that is getting paid whether they fight or not fight, right? They are only getting paid on that day of the fight. So,
Yeah.
with that allows you a little bit of flexibility to talk things out a little bit more severe. So like if you're a stress fracture, I mean, first and foremost, it depends on where the stress fracture is. It depends on the limitations and functional limitations in front of me, right? So like if it's a small stress fracture, but they're super limited objectively, that's going to be someone that I might say, we need to have a further talk. If there's someone that we suspect maybe a stress fracture, but objectively they can move, walk, run, jump, train fully, they don't have any restrictions, that's going to be someone I might approach a little bit different when it comes to that. So I think every case is very unique and specific to the person in front of us. So it's hard to make a judgment call on one thing going a certain way. We have to be very flexible. We have to be very dynamic clinically, and we have to see like what is in front of us. So we take objective measures, we take clinical experience, we take game plans of the technical training and the technical coaches, and we have to push all that on top of each other to come up with that solution.
Got it. So this brings us really nicely into return to sport testing. And I think we have some really nice sort of clinical criteria or return to sport guidelines that we often rely on as clinicians. I'm thinking ACL, for example. We're looking at like 90% limb symmetry indexes. We're looking at hop tests. Like range of motion should, of course, already have been there.
Counter movement jumps, you name it, right?
Yeah.
We have a lot of ways to test objective now, which is amazing. And I think clinically that gives us a lot more credibility, especially with the other performance teammates that we have, right? Especially when we're going from return to play to return to performance, like when we're bridging that gap from medicine and health to performance. And that's where that kind of blurred line is, and objective testing and stuff gives us a lot of great insight on that. I think with that, we also have to not forget our clinical expertise, our clinical hands-on skill sets and things like that, because someone could look great, but still feel like crap. Right.
Yeah.
And I think we have to bridge that gap in the middle to kind of be the best possible clinicians that we can. I love that we are getting more objective. And I think because previously, I would say when I first started, we weren't there. And that's something where it's been really lovely to see the PT profession evolve to get more objective information. But I also think sometimes you get down those rabbit holes where you only have that objective information and you're missing the point over here as well. So I think there's that like middle ground of clinical experience, hands-on, what you're feeling. Because I always tell to our students, like, if you expect range of motion or you're testing to look good or respond well, you can't like have a joint that doesn't feel good, right? So if you're like an ACL, if you're looking at trying to do some dynamo testing or some force frame testing, and that joint that day feels like crap, you're not going to get the right objective information that maybe you're looking for. So place your hands on that patient, see what the joint feels like, the tissue quality feels like surrounding what you're going to test, and then test it, because it might give you some insight. Maybe they're just having a bad day and they woke up and they're a little more swollen and their objective measures aren't going to meet your criteria. Right. But maybe the following day they look great. They had a good night's sleep. Nutrition was on point. And now objectively they look where you think they are. So I think you do have to meet in that middle ground there.
Right. Yeah. It's their testing can be off day to day. I could also imagine that sometimes, let's say you're just measuring their quad strength in the case of an ACL. Everything looks great, but obviously that's just one step. And in a fight, it's way more complicated than just an isolated single joint movement. So how important is sort of understanding the actual sport itself and how the athlete fights and what they can or cannot do?
I think you make a very valid point, and that's something that I think we do really well at the UFC Performance Institute is really look at the sport with a fine-tooth comb. Baseline testing, things like that. Like we've actually evolved our own kind of baseline testing to match what a punch looks like, because there just wasn't any testing out there that really mimicked the sport. So we have become really creative in what we do objectively. We literally, the other day, we were just talking about new diagnostics for us that kind of just fit this athlete better. One of the things we said, we look at NFL, we look at how when they do baseline testing, they test a quarterback the same way they test a lineman. And these like characteristics you need for these two different positions are extreme. So how are you testing people the same in those same positions? I go back to when I first graduated. Yes, FMS was a huge thing, but really, what objective information did it feed us? Let's be honest. The athletes all failed the same exact thing, no matter if they were a baseball player versus a track and field. They all failed the core one when they're on quadruped. And that gave me no insight to their sport. So I think objectively, we also need to look at the athlete in front of us, the sport we're doing, the position, or what their game plan is. For us, it's really game plan. If you have a grappler, you're looking at those common grappling injuries and making sure they're okay in that perspective,
right?
Not matching a grappler with a striker because that's really different. And I think we have to be way more sensitive and specific to what the person in front of us needs to do to complete their game plan in whatever sport they're in, and make sure that objective testing mimics that, like you touched on.
Right. Yeah, it's so interesting. Like if you're dealing with someone who has a pretty serious wrist injury that maybe gets worse with a lot of impact,
right,
and they're a grappler, like maybe you can get around that, right? Like maybe they don't rely on their striking so much.
Exactly. So you just have to understand the person in front of you, right?
Yeah.
Because even athlete to athlete, it's going to be a little bit different. What is their background? Did they grow up wrestling? Did they grow up boxing? These are all going to be things that we need to look at with our objective testing a little bit more closely, just to make sure that athlete gets back to what they need to actually do themselves.
Right. Are you ever going to their practices or looking at tape and sort of walking through the movements that they're doing and the forces that are required of them, and sort of bringing that into the testing?
Not only do we have the UFC Performance Institute, but the two facilities in China and Mexico are also academy style, where they're developing athletes. So we cover practices there. So my staff on the ground is, covering the sport inside and out in different types of practices, whether it's technical training, whether it's drilling, whether it's live goes. So they're really understanding that. And then I would say also the team here in Vegas, whenever we're doing return to plays, we're always upstairs where most of the training occurs to get those reps in, and incorporating sport specific return to play into things. So a normal ACL for a football player, you're not taking shots on the ground, right? Where you're going in on your knee and bouncing off the knee and coming back up to shoot on someone.
Right.
So those are things that we actually have to implement into our return to plays, because the sport requires them to do so. So I think that's a really cool thing that the team gets to experience. And then we also cover every event. So we assist event night. So we're able to watch the events in front of us, learn, see the mechanism of injury that occurred, then eval them right afterwards to see what that looks like. And then, so it's a very quick turnover with getting to understand that injury.
I love it. I know I do jiu-jitsu myself, and I understand the demands that it places on your body. And I find that anytime I've been working with a jiu-jitsu athlete who, let's say, tore their ACL or their MCL, their return to sport testing, a lot of it's the same at first. Exactly. Yep. But the details, they have to be different, because as you said, you don't have to shoot and go for a takedown, or you don't have to deal with so much compression and twisting.
Right. Wrapping your legs around, to get a submission. And really, I mean, it's funny because people don't think about this, but they have to be so strong in their lower extremities when they're grappling. Because, when they're getting their hooks in and stuff like that, they're using that as almost like your arms, right? Yeah. So they have to be really strong and controlled. And if you are rehabbing a knee ligament injury, you have to keep that in mind.
Right. I'm curious, when it comes to ACLs, have you heard or have you implemented the cross bracing protocol at the PI?
So we haven't at the moment, only because I can't get a brace or anything on this population for more than like a few days. They literally do not tolerate it. But it's interesting because some of my coworkers that are around the world who other sports have implemented it, they've seen some good results. But I don't know if we can get this combat athlete to actually be compliant with wearing a brace. I can barely get them to tape something when training, like a brace, even off like a post-op meniscus or an ACL that the doc's like, hey, I want them braced for 4 weeks. I am lucky to get like a week out of them. And then I'm like, they walk in, literally, this population is so sneaky that we have had athletes that are in boots or braces, put it in their car, take it off when we never see it. When they arrive to PT, we've actually caught them pulling it out of the trunk.
Oh my gosh.
In the door. And I'm like, that does nothing for you.
Yeah.
I just, at the moment, right now, it would be very hard to get this population to buy into it. But it's something that's, I think, quite interesting.
Yeah. I was asking because speaking of buy-in, it sounds like a lot of them would be more prone to relying on non-surgical treatments because the surgery, you're typically, you're out of commission for a little bit.
Yep.
But I guess the bracing's a bit too much because that sort of boxes you in as well.
Agree. And I would say like people don't realize that. I'm hoping one day to get this study completed, but I think this population are really big copers because a lot of their, I think, injuries occur just because of the sport. So their body has adapted over time. Like our ACLs don't blow up. Like I literally have had, I could probably count on my 20 to 50 in the last like 5 years of athletes come to me and be like, hey, I just tore my ACL and I have no swelling. I have full range of motion and I have full function back within like a week. And I'm like, that's not normal. My NFL guys that come in, they're blown up. The surgeon's like, you got to get that swelling out. They feel like Bambi on their leg when they try to weight bear through it. So it's one of those things that I just think we're really good copers in this sport. And I'm quite intrigued where the research goes to give us some evidence on, that non-surgical, that conservative route, because I think we have a lot of that.
That's fascinating. I forget who the fighter was, but I watched them finish a fight with practically every ligament blown out in their knee.
Oh, it's insane. The amount of everything that we are taught in school about stability, throw that out the window. The population is going to challenge it.
What's one of the craziest coping instances you've seen?
Well, I think Francis Ngannou right there nails it, right? I mean, he beat Cyril Kane with no ACL and a grade 3 like MCL, and literally that's 4 weeks out from his fight, and he's able to win a world championship on a very tough opponent. Like, Kane is not easy. So and he was so agile and adaptable. And I remember even 3 weeks out, his coach being like, Heather, do we really think he could do this on this? And I'm like, everything I'm throwing at him, he's just crushing it. Like, give the guy a chance. Let's see if he defies everything that we think we're doing right now. And he did.
Wow. That's incredible. That's incredible.
There's so many of those stories too. I could probably write a book on it.
You should. I'd love to read it. I think it would be a good book to read for physios because it would question a lot of their beliefs.
Yeah.
What have you learned from working with some of the toughest people on the planet and just about the human body and about resilience?
The human body is super adaptable and, I mean, as resilient as you allow it to be is what I want to say. And I want to say that like everything we're taught to fix and to be worried about, I have almost seen that your body can adapt and find another pathway. And it's pretty crazy on that. Like it's something that I think I love watching our new physical therapists or our new students come in and be like, oh my God, this person's only this amount of week, or they don't have these ligaments and they don't have this. And how are they doing what they're doing? I love that. I love that. Like every day I have, coworkers of mine banging their head against the wall and going, is this really, can they do this? Can the body actually adapt and do this? I mean, my first time I saw an athlete after a fight, I literally wanted to order an x-ray on pretty much every joint possible because I was like, that's fractured, that's fractured, that's fractured. And we did. And every x-ray came back negative. And I was like,
Oh,
how does the body look like that and not be broken? And literally within 7 days, that athlete looked great and was back to like full training. And I'm like, holy moly. But like from leg kicks to see the expansion of swelling and edema and like loss of function, and then turn and flip and be back in like 7 days, it's pretty incredible.
yeah, it's remarkable. Do you find that I'd imagine with this population, sometimes you just need to be the voice of reason, or at least help deliver the pros and cons, the risks and rewards, which we touched on. A lot of physios have to deal with reassurance and motivating their patients and allowing them to trust their bodies. Do you feel like you ever have to do that with some of these fighters, or is that mostly handled for you?
I mean, I would say mostly handled for me. This population wants to tell me they can do something, and I'm like, hold up, let's just give it a few days.
Yeah.
So motivation is not something, but I can say it's also very frustrating for myself and the staff members when we might need that extra day. We're like, okay, we can get you there. Just trust the process. So, instead of having to motivate them, we have to figure out how to meet the athlete in the middle. So instead of saying, hey, I don't want you to do wrestling, you're going to say, I need no takedowns, no impact on this. You could do X, Y, Z. Like, I want you to drill from this position and do this. You have to do that give and take with this population.
Yeah.
So you don't have to motivate them, because believe me, they are the most motivated, athlete I've ever worked with.
Right.
But sometimes you have to reel them back and negotiate, be really good negotiators.
Yeah, it's never a problem of saying like, hey, we really need you to start loading this tissue. The brace is already in the trunk. Yeah.
They're walking at home and you're like, no.
Yeah.
Then it makes you challenge it. Like, right. It's funny because also we have such a global sports medicine team. So I have like sports medicine philosophies from Australia, from England, from China, from Spain, all over the world. And to see what the post-op differences are from restrictions, contraindication, all that kind of stuff is very different depending on where my clinicians came from.
Yeah.
So like in Australia, they don't ever brace or like do weight bearing restrictions on a meniscus repair. They just don't.
Oh, really? That.
Where here in the States, we have it done more frequently, that 6-week mark, that less than 90, and there they really look at where was the tear. If it's in that posterior aspect, they're not hit, just keep them above 110 of flexion and weight bear all you want, because that compression is driving more fluid and that's repairing it better. So it's intriguing and interesting to see how society and culture all rehab a little bit different and have different parameters around that as well.
Yeah. So you deal with people from all around the world. How do you determine what protocols to follow?
I mean, I think it's going to be, again, taking your objective measures, reading your post-op reports, having good communication amongst your physicians to really understand. And, I feel like we've developed really good relationships with the physicians. If something is not looking quite right, being the first to speak up and say something's not right. Like you said, nothing is perfect.
Yep.
Even a surgical repair might not go down a really clean pathway all the time. There is risk on everything you do. And I think the more you get ahead of it and not be nervous to say like, oh, this doesn't look perfect. Is this my fault? Is this the doctor's fault? Is it the athlete's fault? Getting on that same page and having that really good trust and that really good communication up front allows you, to make those better decisions. Yeah. And I think by that, we do journal clubs where my team roundtables on different research articles or different, case studies where we bring in all of our philosophies and say, how do we develop a PI philosophy from, instead of saying, oh gosh, Australians do it this way, like, hey, maybe some of the stuff they do is better than us. Hey, maybe some of the stuff we do is better. So let's like bridge that gap and meet that unified approach and really find our own that we can kind of challenge the systems collaboratively together.
Yeah, I was about to ask how you stay up to date as a team. Like, are there any protocols in place outside of the journal club?
Yeah, I mean, we challenge a lot. We're developing a little bit more protocol based, I would say. I always struggle with protocols a little bit. I'm the person that, if it says you can do something between 2 and 4 weeks, who says you don't do it week 2? Who says you don't do it week 4? Right. Yeah. So I'm like, when they give us these time frames of like 4 to 6 weeks, you're doing this. Well, what determines, at that week 4 in one day? So I'm the person that's like, hey, get that objective measures, get that clinical pearl of like, with your hands on it, what does it feel like? How do they look? And then make a really good return to play that's kind of challenges the systems, but at the same time, keeps in mind tissue healing, things that we can't speed up, right? Like I can't make a fracture heal in 2 weeks. We know that, right? Like I'm not going to be naive and, go down that avenue. So finding those clinical pearls of like where we can challenge those and cut time off, but where we also respect tissue healing and all the biology that we've learned.
Yeah, got it. Makes sense. Do you feel emotionally invested when a fighter is getting back into the cage and you've worked with them? Like, are you nervous about them getting hurt?
It's not nervous about getting hurt. I'm like a mom of 700 athletes. A lot of children to emotionally be like, so, you will see me when we are ringside, I will watch a screen because the screen doesn't seem as real.
Oh, wow. Really?
But when I look forward at the octagon and I hear something, I can genuinely say, ooh, that could be broken, or that sounded like a ligament or a muscle or a this. So if I watch the screen, I don't put that reality together as much. But I will say I'm definitely an emotional, I would say, mom to all of these guys, especially if I've worked with them, especially if I've done a long-term return to play. You do want to see them succeed and not have any issues with what you rehabbed. But at the same time, you're working with both people. So you're emotionally connected to both opponents out there.
Oh, wow.
All I can always say is like the minute they walk into that octagon, my job is done. Like health now is in their hands. And then when they come out of it, it's my job to get them back as safely and as quickly as possible, that they can do what they love to do and they can support their families.
Yeah. Do you feel a lot of pressure? Because they again, as you said, they only get paid when they fight. Right? Yeah. So do you feel like the fighters place a lot of pressure onto you? And if so, how do you overcome that?
So I wouldn't say the fighter puts the pressure on me because, I think I put the pressure on myself in that sense. I think the fighters are very, appreciative. They're that type of population. I get text messages on Mother's Day. Thanks, Mom, for taking care of us and caring more than we care about ourselves.
Oh, my gosh.
So I think it's myself that puts the pressure on. Like, I want them to be healthy. I want them to be something after sport. That's another thing you asked me what my dream is that transition from sport to human, I think is so critical. And I've just experienced a lot of athletes that didn't know what was next. So if I can be one voice of reason on like, hey, look at the future. You're an athlete right now, but that's not your identity, right? It's just one part of your life. And I think one of my colleagues says something like, we're just placeholders. We're there helping at this small point in their life, but like really what we want to see is success through their whole life.
Yeah.
And, this is just one point of their career and we hope we can help them as much as we can.
Right. I did have that thought. I'm a huge believer in like loading is amazing for the body and that we should be completely as active as possible. But usually in most things in physiology, there's such a thing as too much. Yep. And on one hand, you have someone who needs to make a living and needs to participate in their sport. On the other hand, you have them after that, right? Yeah. And so what sort of conditions or injuries do you have a lot of concern of for maybe developing into something else later down the road?
Yeah, I think especially with our grapplers have a lot of like cervical disc, lumbar disc. And I know myself experiencing that before. Like those are things that can be, drive you nuts down the road. Even you sleep funny, you're on an airplane funny, things like that. So, teaching them life skills that, even though we're rehabbing, we're looking at like daily exercise, posture, things that can help them, that we would help anybody that's out there. And I think that's so important is, yes, they're an athlete, but after an athlete, they're going to be just like you and I.
Yeah.
And, you know, what everyday stuff do? We sit at computers, we sit on our phones. So, you know, they might wear down grappling with their necks, but then they're sitting on phones and doing things with kids later in life. So they're going to have the same kind of common injuries. So we hope to mitigate that and reduce those risks early on so that hopefully they can have a normal life like you and me.
Cool. Awesome. I have one more question for you, Heather. There's a lot of new grads that listen to this podcast, a lot of young physios, a lot of young students. If you could restart your career or step into their shoes, what are some of the most important lessons that you would try to instill?
I think the most important lessons are still hard work is really required. I see a lot of new grads, as myself, guilty when I first graduated. You want these big plans, right? I wanted to be in sports. I wanted to do this. People forget it took me 20 years to get here. So, you know, it did take, you know, hard work, dedication, excitement, passion for this. I would say as a new grad, find what you absolutely love. Because if you're not doing what you love, you know, career tends to take a toll on you as well. But for me, I absolutely love this, and every day doesn't feel like work. So I think, like, you know, hard work, dedication, find your passion that you're really, you know, focused on and something that's going to make you happy. And then, you know, that willingness to learn. That's what I always say. Like, I still don't know everything. My new employees, I learn from everybody, right? Even in different disciplines, my strength coaches, my sports psychology, like, keep that open mind. And I think the more you can pull in and gain knowledge from, I think the better you become help for your patient or your athlete in front of you. So
I love it. So important. So for everyone listening, like, the learning never stops. Right?
Never
Nobody
stop.
knows it all. Cool.
Yes.
All right. Heather, anything you want to add as we wrap up? I really appreciate you coming on.
No, I've absolutely loved chatting with you. And I think, like, you pulled out some questions that I've never had before. And I kind of love that, you know, so thank you for, you know, just having a really open conversation with me.
Of course. If you ever want to have one again, I'd be more than happy to have you. I think you have such a cool job. Obviously, what physio wouldn't think that? So I'm so curious about your perspective, and I appreciate you sharing it with everyone today.
Thanks for having me.
No problem. Okay.